did a bilateral inguinal hernia. The patient had a right-sided pantaloon hernia where there was a direct and indirect defect. It became very easy using the robotic system. The system was very good. I've used other robotic systems as well, and it compares fairly well with those robotic systems. It's in fact better than most of the other recent robotic systems that I've used. So in terms of ease of use, it was very, very easy, and it took a little time to get used to the hand controllers, but once I got used to it, it was nice. More than anything, it was the use of energy with an articulating scissors that made it very easy for us to dissect the space for the inguinal hernia repair. In addition to that, suturing, obviously, with the suturing with the articulating instruments, made it very easy. It was very quick and it was fairly comfortable. Support and training has been good. There have been two people who've been coming in for training, and I think one other person had come in for the surgery, and they've been helping us with the docking, undocking process, draping, everything. Honestly, I've not done too much training. I just did a couple of hours of training, but that's because I've used other systems which are similar to this system, so it didn't take much time getting used to it.